Have you ever noticed how even a small change in your daily routine can ripple into something much larger? Imagine a moment when a slight imbalance causes a fall, or a seemingly insignificant shortness of breath becomes the precursor to a life-threatening condition. Today, we are diving into one of the most critical topics for anyone over the age of 70. In the next few minutes, we will detail 8 primary causes of death for seniors over 70, each backed by solid statistics and real-life examples, to underline that every minute matters. This isn't just about statistics, it's about protecting your life and the lives of those you love. For too long, many people have shrugged off minor changes in their body as a normal part of aging. Yet, these small signs often indicate deeper issues. If ignored, these signs can quickly escalate into conditions that are difficult, and sometimes impossible, to reverse. Today, we'll empower you with knowledge and concrete steps to help prevent these tragic outcomes. Stay with us as we unpack these risks, highlight the early warning signals, and provide actionable advice to take charge of your health. Remember, procrastination is the enemy of prevention. Let's begin. Cause 1, heart disease. Heart disease remains the leading cause of death in those over 70, often referred to as a silent killer. Many of you might experience mild fatigue, shortness of breath, or a rapid heartbeat and dismiss these as signs of just getting older. However, the heart is a resilient muscle that requires care and attention throughout your lifetime. Warning signs. Unexplained fatigue during simple activities. Shortness of breath even with minimal exertion. Occasional dizziness or chest discomfort. What you can do. Regular check UPS, schedule routine checkups including EKG tests and blood pressure monitoring. Healthy diet, emphasize whole foods, lean proteins, and reduce salt and unhealthy fats. Exercise, engage in moderate physical activity such as walking, swimming, or gentle aerobics daily to strengthen the heart muscle. Medication management, if you are prescribed medication for heart conditions, take them consistently and have your regimen reviewed periodically. Every heartbeat matters. Don't wait for an emergency to realize you've been neglecting your heart. Cause 2, falls and accidental injuries. Imagine a simple misstep turning into an injury that could change your life forever. For seniors over 70, falls are one of the most common, and preventable, causes of fatal injuries. What may start as a minor stumble can lead to hip fractures, head injuries, or even complications like infections that can severely diminish one's quality of life. Warning signs. Occasional loss of balance. Dizziness when standing up too quickly. Recent instances of tripping over objects. Preventive actions. Home safety. Make your home safer by installing grab bars in bathrooms, ensuring proper lighting, and removing any tripping hazards like loose rugs or clutter. Exercise for strength and balance. Simple exercises like Tai Chi, yoga, or balance training can improve coordination and reduce the risk of falls. Medication review. Some medications cause dizziness or lower blood pressure. Regularly consult your doctor to adjust these if necessary. Vision and hearing tests. Impaired vision and hearing can increase the risk of falls, so get these checked regularly. Act now. Each trip or fall warning sign might be your body's way of asking for help before a small incident becomes a life-altering event. Cause 3, respiratory diseases. Breathing is something most of us take for granted, until the ability to breathe clearly is compromised. Respiratory diseases, including chronic obstructive pulmonary disease, COPD, pneumonia, and asthma, take on a new level of danger once you pass the 70-year mark. Warning signs. Persistent cough or wheezing. Shortness of breath that worsens during physical activity. Frequent respiratory infections or bronchitis episodes. Steps to protect your lungs. Avoid irritants. Stay away from pollutants such as cigarette smoke, dust, and chemicals. Vaccinations. Keep up with vaccines for influenza, pneumonia, and other respiratory infections. Regular lung function tests. early detection can be key. Consult your healthcare provider about periodic lung function assessments. Physical activity. Engage in light exercises that enhance lung capacity, such as gentle walking or water aerobics. Indoor air quality. Consider air purifiers, especially if you live in urban areas or places with high levels of airborne pollutants. Remember, every breath counts. Improving your respiratory health today can prevent the silent buildup of damage that might later lead to life-threatening complications. Cause 4. Stroke. A stroke can change everything in the blink of an eye. It occurs when blood flow to your brain is interrupted either by a blockage or a burst blood vessel, leading to rapidly deteriorating brain function. Although the onset might be sudden, many strokes are preceded by subtle warning signs that can be detected early if you listen to your body. Warning signs. Sudden numbness or weakness in the face, arm, or leg, especially on one side. Trouble speaking or understanding speech. Visual disturbances in one or both eyes. Severe headache with no known cause. Loss of balance or coordination. Crucial preventive measures. Control blood pressure. High blood pressure is one of the strongest risk factors. Monitor it regularly, adhere to a low-sodium diet, and take prescribed medications consistently. Healthy lifestyle. Avoid processed foods, engage in regular physical activity, and maintain a healthy weight. Medical screening. Regular checkups that include cholesterol and atrial fibrillation tests can help in early detection and preventive management. Immediate response. If you notice any of these signs, even if they seem minor, seek medical attention immediately. Prompt treatment can reduce the risk of permanent brain damage and improve recovery outcomes. A stroke doesn't wait, and neither should you. Stay alert to the signals your body gives you and make proactive choices about your health every day. Cause 5. Cognitive decline and related complications. As we age, our brain too faces its own battles. Cognitive decline may begin with what seem like minor lapses, forgetting a familiar name, misplacing your keys, or having trouble following a conversation. For many seniors, these early signs are mistaken for mere forgetfulness. However, they can be the first hints of more serious issues such as dementia or Alzheimer's disease, both of which can have devastating consequences on your independence and overall quality of life. Warning signs. Difficulty recalling recent events or conversations. Repeatedly losing everyday items or missing appointments. Confusion in familiar surroundings. Challenges in problem-solving or decision-making. Noticeable changes in personality or behavior. Actionable steps. Stay mentally engaged, regularly challenge your brain with puzzles, reading, or learning new skills. Even engaging in simple crosswords or memory games can help keep your mind sharp. Physical exercise. Studies show that physical activity increases blood flow to the brain. Incorporate light exercises such as walking, gardening, or gentle yoga into your routine. Social interaction. Maintain a vibrant social life. Regular conversations with friends and family or joining community groups can significantly delay mental decline. Healthy diet. Consume foods rich in omega-3 fatty acids, antioxidants, and vitamins. Leafy greens, berries, nuts, and fish are known to support brain health. Regular cognitive assessments. Early diagnosis is key. Periodically visit your healthcare provider to assess your memory and cognitive functions so that any issues can be addressed promptly. Your mind is your most valuable asset. Every effort you make to stimulate and care for it today can help secure your independence for tomorrow. Cause 6. Cancer. Cancer remains a formidable adversary that does not discriminate by age. For many over 70, the risk of developing cancer increases significantly due to a lifetime of exposures and genetic factors. Although cancer can appear suddenly, many types develop slowly, making early detection both possible and critical. Warning signs. Unexplained weight loss or loss of appetite. persistent pain that does not respond to treatment, unusual lumps or growths under the skin, fatigue that lingers even after rest, changes in skin appearance or moles. Prevention and early action. Routine screenings. Engage in regular cancer screening tests such as mammograms, colonoscopies, prostate exams, and skin checks. Early detection can dramatically improve treatment outcomes. Healthy eating. A diet rich in fruits, vegetables, and whole grains can help lower cancer risks. Avoid processed foods and limit alcohol intake. Physical activity. Regular exercise not only strengthens your overall health but also aids in maintaining a healthy weight, a key factor in reducing cancer risks. Sun protection. Even after 70, protecting your skin from the sun's harmful rays is essential. Wear protective clothing, use sunscreen, and avoid prolonged sun exposure during peak hours. Stay informed. Keep an open dialogue with your healthcare provider about any unusual symptoms. Early intervention often makes the difference between manageable treatment and more complex health challenges. Cancer may be daunting, but by staying vigilant and proactive, you put yourself in the best position to fight back. Don't wait until it's too late, make prevention a daily priority. Cause 7. Diabetes and its complications. Diabetes is another condition that grows more prevalent as we age, and its complications can lead to serious and sometimes fatal outcomes if not carefully managed. High blood sugar levels over time can damage blood vessels and organs, making even minor fluctuations dangerous. Warning signs. Frequent urination and unusual thirst. Unexplained fatigue or blurred vision. Slow healing wounds or frequent infections. Tingling sensations in the hands or feet. Unintended weight loss. Steps to manage and prevent complications. Blood sugar monitoring. Regularly check your blood glucose levels and record any significant changes. This practice is key to managing diabetes effectively. Balanced diet. Focus on a diet low in refined sugars and high in fiber-rich vegetables, whole grains, and lean proteins. Consult a nutritionist if needed to plan meals that stabilize blood sugar levels. Regular exercise. Engage in moderate activities that help lower blood sugar, such as brisk walking, water aerobics, or cycling. Even short, consistent sessions can yield significant benefits. Medication adherence. Ensure that you take your prescribed medications consistently. Work closely with your healthcare provider to adjust your treatment plan as needed. Foot and eye care. Diabetes can affect circulation to your extremities and eyes. Maintain regular screenings with a podiatrist and ophthalmologist to catch any issues before they worsen. Stress management. High stress levels can negatively impact blood sugar control. Practices such as meditation, deep breathing, or even gentle stretching can be invaluable. Managing diabetes isn't just about keeping blood sugar in check, it's about taking control of your overall health to prevent the cascade of complications that can arise when the condition is neglected. Cause 8. Kidney disease. Kidney disease often goes undetected until it reaches an advanced stage. Our kidneys work tirelessly to filter waste from our blood and regulate essential chemicals in our bodies. As we age, the risk of kidney dysfunction increases, sometimes due to conditions like high blood pressure, diabetes, or prolonged use of certain medications. Warning signs. Changes in urination patterns, frequency, color, or consistency. Swelling in your hands, ankles, or around your eyes. Persistent fatigue or shortness of breath. Loss of appetite or nausea. High blood pressure that's difficult to control. How to safeguard your kidney health. Regular testing. Have your kidney function tested as part of your routine health checkups. Early detection can lead to interventions that slow progression. Hydration. Drink adequate water each day to help your kidneys flush out toxins, but be sure to discuss fluid intake with your doctor if you have an existing condition. Medication vigilance. Some over-the-counter painkillers and prescription medications can strain your kidneys. Review your medications regularly with your healthcare provider to ensure they're not adversely impacting your kidney function. Dietary adjustments. Reduce sodium intake to help maintain healthy blood pressure levels. Focus on a balanced diet that supports overall kidney health. Think fresh produce, whole grains, and lean proteins. Control underlying conditions. Managing diabetes and high blood pressure is vital. Their proper control is the first line of defense against kidney damage. Lifestyle choices. Incorporate regular physical activity into your life and avoid smoking, as both can impact kidney efficiency and overall health. Your kidneys are essential to your overall well-being. By keeping a close watch on these warning signs and making conscious lifestyle choices, you can help preserve kidney function and prevent life-threatening complications. We've taken an in-depth look at 8 critical causes of death in those over 70: heart disease, falls and accidental injuries, respiratory diseases, stroke, cognitive decline, cancer, diabetes, and kidney disease. Each of these conditions may start with seemingly minor changes: a little extra fatigue, a slight imbalance, a momentary lapse in memory, but these early warnings are not to be ignored. Today's message is one of empowerment. You are not destined to be a statistic. Every step you take, from regular health checkups and screenings, to daily exercise, balanced nutrition, and attentive self-care, is a step toward a longer, healthier, and more independent life. Remember, act early. Small changes add up. An extra walk, a healthier meal, or a call to your doctor might be all that stands between you and a serious health complication. Stay informed. Be proactive about learning the signs your body gives you. Knowledge is your best defense against the rapid progression of these conditions. Engage actively. Interact with your community, support groups, and healthcare professionals. Share your concerns and experiences so that you're not alone on this journey. Take charge. Every minute counts. Don't wait for symptoms to worsen or for an emergency to strike. Be proactive, be vigilant, and most importantly, be kind to yourself. Now is the time to re-examine your daily habits, to monitor even the smallest changes in your health. Encourage your loved ones to do the same. We urge you to take that crucial step: schedule your next doctor's appointment, ask for a comprehensive screening, and implement at least one healthy change in your daily routine today. Your life, your health, and your independence are priceless. The decisions you make now will resonate far into the future, shaping not only your quality of life but also the future of those who care for you. Thank you for watching. If you found this video valuable, please share it with your family, friends, and community. Comment below with one change you plan to make for your health and subscribe for more actionable insights. Remember, your vigilance today is the key to a healthier tomorrow. Stay safe, be proactive, and keep taking care of yourself.